Hi guys, Vik Vijh, plastic surgeon. Going to talk to you today about scarring. Lots of patients ask me about scarring, what's good, what's bad, what should I do, what shouldn't I do. So let's talk about it. Scarring. Effectively, once your wound is healed, and that means you've got a completely healed wound with epithelium, skin cells over it, your scar goes through a remodeling phase. And that means that the body keeps breaking the scar down and remaking it. And what it's doing is it's aligning all the fibres in one direction. Now that takes about 6 to 12 months, and sometimes the scar can go awry and you can get something called a hypertrophic scar or a keloid scar. Hypertrophic scars are scars that are red, raised and itchy, but remain within the confines of the original wound, whereas a keloid scar grows outside. So what can we do in these scenarios? Well, for general scars, so that's scars that are maturing normally, I tend to recommend a silicone gel. I tend to use Neurocell MD. The reason I use it is because it comes in a good package, it's easy to deliver, and most importantly, when you put it on, it dries quickly and it's not sticky. And there's nothing worse than having a sticky product on you if you're trying to function, especially if it's on your hand or something, and you keep thinking, God, or if it's on your chest and it's making your clothes, give them a mark or something. We don't want that. So I think Neurocell MD is a good product, and that's for general scars. Okay, so let's talk about what we do if scars go awry, so the scars aren't right. And you get the hypertrophic scar, that's a red raised scar, itchy, remaining within the confines of the wound. Again, a silicone gel like Neurocell MD will work for small ones and it will help settle it down. Now, I don't think it necessarily makes your scar better in the long run, but I think what it definitely does is it helps mature it towards normality more quickly. And I think that's probably the best, evidence out there in my opinion. Anything worse than that, anything bigger than that, you start to get into the realms of having to use pressure therapy or steroid injections. And that's sort of the next level. If you've got the really bad scar, the keloid scar, this is a scar that's growing outside of the edges of the wound. Now we're into sort of a real problem. With keloid scars, you're into the same steroid therapies, you're into the use of excision and pressure. There's a new treatment out there where we can freeze keloid scars as well, and there's some good evidence that that helps. Once you've done those treatments, again, whatever scar you've got, be it the hypertrophic scar or the keloid scar, once you've done the main treatment, I would still go back to using some silicone gel or some silicone cream, something like the Neurocell. And I think that is probably the best way to manage your scars.